So hello, everybody. My name is David Eade. I am a graduate student from Kent State University, currently on internship at VA Puget Sound American Lake in Tacoma, Washington. And my title of my presentation is Self-Care Confidence Predicts Less Depression in Heart Failure. So depression is up to 5 times more prevalent among those with heart failure than in the general population, and is associated with increased mortality and hospitalization. It's been found that poor and/or worsening health is a predictor of depression among those with heart failure, and therefore consistent and adequate self-care behavior might preserve one's health and therefore be a protective factor against depression. So I wanted to look at the role of self-care confidence in heart failure, which could be defined as confidence in one's ability, in other words, self-efficacy, to maintain one's physiological stability and respond to heart failure symptoms. I also wanted to look at predictors of self-care confidence. Some past studies have shown that heart failure education programs improve self-care confidence, and maybe one mechanism is by improving heart failure knowledge. Also wanted to look at the role of personal beliefs and attitudes about heart failure, as this can also impact aspects of one's self-care, including medication adherence. So this is kind of a conceptual model of my hypotheses. Starting on the right side of this model, I hypothesized that a higher level of heart failure symptom burden would be predictive of greater depression, that self-care confidence would be predictive of less depression, and that self-care confidence might moderate the relationship between heart failure symptom burden and depression. In other words, if one has a high level of heart failure symptom burden, but a very low level of self-care confidence, they might be more likely to become depressed than someone who has a high level of symptom burden, but an equally high level of self-care confidence. I also wanted to look at predictors of self-care confidence, looking at the left side of this model. And I predicted that greater heart failure knowledge would predict greater self-care confidence, and that more accuracy regarding beliefs around heart failure might also predict greater self-care confidence. So my sample included 324 adults with heart failure, and I used a number of self-report measures, including the PHQ-9, Kansas City Cardiomyopathy Questionnaire for heart failure symptom burden, the Self-Care and Heart Failure Index, which consists of 3 subscales, self-care confidence, self-care maintenance behaviors, and symptom management behaviors, the Dutch Heart Failure Knowledge Scale, and the Survey of Illness Beliefs in Heart Failure. My first 3 hypotheses were tested via a moderation analysis, and my 4th and 5th hypotheses were tested with a hierarchical regression. So my moderation analysis found that 30% of the variance in depression could be accounted for by heart failure symptom burden, heart failure self-care confidence, and the interaction between them, with a pretty strong effect size of Cohen's F squared equals 0.429. I did find that a higher symptom burden was predictive of greater depression, and I also found that greater self-care confidence predicted less depression. However, an interaction between the two was not found to be statistically significant. In my regression analysis, 11% of the variance in self-care confidence was accounted for with heart failure knowledge and beliefs, with a much more modest effect size, Cohen's F squared equals 0.017. Greater heart failure knowledge was generally associated with greater self-care confidence. This was a trend, but P equals 0.08 in this case. A positive relationship between accuracy of heart failure beliefs and self-care confidence was not found to be statistically significant. So the finding that heart failure symptom burden predicted greater depression does corroborate past studies showing that poor and/or worsening health in heart failure predicts depression. Also, my study was the first to demonstrate that self-care confidence can predict less depression. So this could be clinically useful for screening and intervention purposes among a heart failure population. An interaction effect was not found, so perhaps there's a different mechanism by which self-care confidence might impact depression. So for instance, maybe greater confidence predicts more self-care behavior, which can preserve health and lessen symptoms, which in turn might predict less depression. Regarding predictors of self-care confidence, past studies have found that education programs increase self-care confidence, but in my study, heart failure knowledge was only a modest predictor of self-care confidence. So perhaps it has more to do with the education program itself. Maybe it's more about the improvement of knowledge. Maybe it's more about one's perception of their knowledge rather than their actual level of knowledge. Or maybe it has more to do with literacy, the ability to obtain and apply knowledge. Also, while total accuracy of beliefs was not predictive of self-care confidence, when I looked at the item level as an exploratory analysis, some specific beliefs regarding control of heart failure were more correlated with self-care confidence. so some limitations in future studies. So there could theoretically be multiple directions of prediction via my analyses. So I found that self-care confidence did predict less depression. It could theoretically work the other direction though, where more depression impacts one having less self-care confidence. And my analyses were constructed in a way that causation could not be established. And as mentioned, there may be other potential mechanisms for the influence of self-care confidence on depression. So in future studies, we could further explore other predictors of self-care confidence and develop interventions to increase it. We could further explore the influence of specific beliefs on self-care confidence, as well as further examine the longitudinal course of depression in heart failure, as well as other predictors of depression in heart failure. And that brings me to the end of my study. So happy to take any questions.
Okay, anyone have any questions? Again, go ahead and feel free to put them in the chat. All right, looks like Julie said this is so interesting. It makes me it makes me think of surgeries for which we have much more strict about patient preparation, such as organ transplant evals, and what might happen if we were more consistent about it across procedures. That's, yeah, interesting point.
Absolutely.
And we got one more here from Dr. Hernandez. What may have driven you to study heart failure specifically?
Sure. Well, my general kind of program of research is most broadly health psychology and behavioral medicine, but more specifically cardiovascular psychophysiology and behavioral medicine. And kind of a pet interest in the biopsychosocial kind of impacts of heart failure and how it does impact us psychologically and vice versa. There's kind of a chicken and egg effect between depression and heart failure, where it kind of works in both ways, where if one is more depressed, they oftentimes their health behaviors kind of fall by the wayside, and it's a very strong predictor of heart failure. And as we can see in my study, it also works the other way too. So there's a strong psychological component in this health population.
Gotcha. Great. Looks like we have one from David. It says self-care confidence is important, but is there an effect of confidence of support that person can, or that a person has available to them? Sorry, we're getting a couple more things pop in here.
I want to make sure I'm understanding correct. Are we talking about social support?
Yeah, David, would you mind clarifying?
Yeah, I'm just wondering if the person themselves doesn't feel very confident of their skill ability, but they have supports in place that they have confidence in, would that have an effect?
Quite possibly, if I'm understanding correctly. And I believe some of those types of items are actually incorporated into that self-care confidence subscale. So it's a mixture of both how I feel about my own ability to kind of maintain my own physiological stability and monitor and manage symptoms, but also I have trust in like my physician and my family to help support me as well. I also controlled for, I didn't really go over this very much, but covariates for social support and impacts on depression as well as self-care confidence too. So there's definitely meaningful variables there in terms of support, for sure.
That would be interesting to see the difference between individuals who are maybe in stable, healthy relationships versus maybe tumultuous, tense relationships, whether married or not, and what the findings would be on that one.
Absolutely.